Hi, this is Dr. TJ An. I just finished minimally invasive surgery of painful hammer toe second digit in my office-based surgery setting. So reason why I'm doing this video is to share with you why you should consider office-based surgery incorporated into your practice. In the other video, I talked about the consideration of minimally invasive surgery in your practice. But in this video, I'm going to focus on office-based surgery. You see, this is my actual office. Everything's in-house basically. As you can see here, I have mini C-arm. I have the operating table, which can also be used with, in my case, a wide podiatry chair. Let me show you. You see, like that. And then I'm kind of walking down the hallway, and then I have all this, the autoclave setup. And my staff, once we finish, it's exactly same standard and regulation. We follow those protocol to disinfect, clean, use ultrasonic cleaner, and then use this autoclave to disinfect and sterilize it, pack it the same way. So why am I showing you this? Once you set this up, you don't have to travel anywhere. You don't have to go to hospital. You don't have to go to surgery center, wait for your turn. Lots of times it's, delays there. And then you have to follow hospital, computer EHR, EMR record, protocol. If you do it here, you save so much time. You see, time is essential. Time is your opportunity cost. By not needing to commute to hospital and surgery center, that itself, it'll free up a lot of your precious time, so you can have more time with your family, correct? And also, because of MACRA and MIPS and value-based healthcare, if you perform surgery in your office base, insurance companies, including Medicare, they will see that as your effort to also save government and insurance company money. So you will be rewarded. Even currently, it may change, but even currently, most insurance plans reward you more by reimbursement rate, 15 to 20% more reimbursement for exact same procedure. Now, I wanna point out, I don't bill facility fee, surgeries, center or hospital charges through insurance company. I don't do that. Make it fair, because insurance company will allow you 20% more reimbursement. It'll cover up, set up your other costs. So if you really think about return on investment, having office-based surgery in your practice, it will not only save you your expense, but also it will increase your bottom line. It's all about return on investment, correct? If you want to increase your practice revenue and decrease your expense, this is definitely one of the best ways to do it that you should consider. Now, I want to talk about patient's point of view. It provides them definitely comfort and convenience, because patients are already used to your staff, you and your practice, your environment. So all they need to do is come in. It's all in one place, and then they don't have to meet new people. They don't have to go to a pre-op room, recovery room with a bunch of other patients. They don't need to do that. So it'll provide them, again, convenience and comfort. Now, also, one of the most important benefit for patients is that you will save them a lot of money. The out-of-pocket co-insurance, deductible. If we perform surgeries at the surgery center or hospitals, they obviously need to charge patients, for their facility fee and supplies to patients. And having patients huge deductible that $5,000 and up in these days, which is not uncommon, by doing surgeries in your office base, basically you bypass all that. Your patients don't need to pay all that high deductible and co-insurance to other facilities. So, and also one more thing, the obviously less chance of hospital infection because you don't perform surgeries at the hospital, you do at the office. So what do you got to lose? It's very, there are economic ways to set up your office-based surgery. I can help you with that, but once you do that, again, this is your playground. You do it here. As soon as you finish, I go to my office, and then patients go home. I mean, you got nothing to lose, but everything to gain by setting up office-based surgery. Now, the beautiful combination is to combine minimally invasive percutaneous surgical techniques. If you obtain and be proficient at minimally invasive surgery technique, then you set up this office space in your practice. It's beautiful. Everything's streamlined. You can systemize it, process it, almost rinse and repeat. You train your staff that way. Circulator, scrub nurse, you can train all that in your office, so everything's under control within your practice. So you are the captain of the ship. I hope this video helped you to understand more deeper about minimally invasive surgery and also office-based surgical suite.